Hey everyone, welcome back to the channel. In today's video, we're going to break down a condition that you'll almost definitely run into during clinical practice, pericoronitis. It's most commonly associated with third molars that haven't fully erupted. And while it might seem kind of routine, the consequences can really escalate if it's not managed the right way. So today we're going to go over what it is, how it develops, what signs you should look out for, and most importantly, how to treat it, both in the short term and long term. All right, so let's start with the basics. The word pericoronitis literally breaks down into inflammation around the crown, and that's exactly what's happening here. It usually affects a tooth that's only partially erupted, most often the lower third molar that hasn't fully made its way through the gums. When that happens, it leaves this little soft tissue flap over the tooth. We call it the operculum. Now, the thing with the operculum is it becomes a perfect trap for food, plaque, and bacteria. And since it's super hard for the patient to clean under there, that area becomes this stagnant zone where bacteria can easily grow, leading to localized infection and inflammation. And that's basically how pericoronitis starts. In the early stages, you might see some swelling or redness around the operculum. Pain is usually there too, but it tends to stay localized unless things get worse. As the infection progresses, you might notice other symptoms like a bad taste or smell, limited mouth opening because of pain, or muscle spasm, maybe swollen lymph nodes, or even a low-grade fever. So yeah, it's not super serious at first, but if it's ignored, it can definitely spread to surrounding areas. Age-wise, you're going to see this the most in people late teens to early 20s, basically around the time when third molars try to erupt. Things that contribute to it include limited space in the arch, crowding, poor hygiene in that area, or just generally high plaque and sugar levels in the mouth. Now, for diagnosis, you don't really need any fancy tools or anything. A thorough intraoral exam is usually enough. If you see a partially erupted third molar with inflamed soft tissue covering it and the symptoms match, it's pretty clear. You might even see pus or food debris under the flap. That said, imaging like a periapical or panoramic x-ray is usually helpful just to check the orientation of the tooth, see if it's impacted, and rule out anything else like a cyst or bone pathology. Once you've confirmed it's pericoronitis, the treatment kind of depends on how bad things are. For mild or early cases, you can often just go conservative. That means guiding the patient on how to clean the area better using saltwater rinses or chlorhexidine mouthwash. Pain can usually be handled with NSAIDs, but if there's swelling, fever, or significant pain, then yeah, you'll probably need to start antibiotics like amoxicillin or metronidazole to get the infection under control. But here's the thing. Just treating the symptoms isn't enough. That operculum is still there, so recurrence is super common unless you address the underlying issue. That's where surgery comes in. In most cases, removing the third molar is the most definitive solution. If you can't do that right away, another option is a operculectomy, basically cutting away that flap. It might help if the tooth is expected to erupt more, but honestly, it's not always a permanent fix if the root cause isn't handled. One clinical tip that's really important: if the infection is super active and severe, don't rush into extraction. Doing surgery in an inflamed area can increase risks and make the whole thing more uncomfortable for the patient. So control the infection first, then go for the definitive treatment. And yeah, that's our quick but solid breakdown of pericoronitis: what it is, how to recognize it, and how to treat it the right way. Thanks so much for watching, and if this video helped you out, don't forget to like it, subscribe for more clinical walkthroughs, and leave a comment if there's another condition you want us to cover. See you in the next one.